Hi, so let's talk about blood sugar spikes. Elevated blood sugar and even the short-term post-meal elevated blood sugar spikes have been recognized for quite a while as major factors that can cause damage to our arteries. But now there is growing evidence that these blood sugar spikes can also harm our brain and even contribute to dementia. Because of this emerging relationship between elevated blood sugar and its effect on proper functioning of our brain, Alzheimer's disease has been frequently referred to as type 3 diabetes. But we don't necessarily have to go all the way to Alzheimer's disease to see the damaging effects of elevated blood sugars. Even things like mood swings, increased irritability, and tiredness are frequently the result of significant blood sugar roller coasters, which can happen even in people without diabetes. We see these short-term and long-term effects on our brain because elevated blood sugar contributes not only to neuronal damage, but over time it can cause even death of the cells in our brain. This seems to suggest that frequent blood sugar spikes which expose our brain cells to elevated blood sugar levels for extended period of time can cause damage in the brain that may be difficult to reverse. Now, we have known for a while now that these damaging effects of elevated blood sugars and even the blood sugar spikes are quite commonly seen in individuals with diabetes. But what about people who don't have diabetes? How does that pertain to them? So before we move on, it's really important to understand that unless we get tested for diabetes, there's pretty much no reliable way to tell if we have diabetes because majority of people have no symptoms for years, even if their blood sugar is elevated most of the time. I've seen many of these patients as a primary care provider in our clinic, and it's always shock for them because they felt perfectly fine until one day when their blood sugar got extremely high and they developed the classic symptoms of acutely elevated blood sugar. So the first thing to do is to make sure that we don't have diabetes. And one of the ways that your doctor can tell is by checking your hemoglobin A1C, which tells us how the body has been handling blood sugar over a period of about 3 months. It basically reflects the average blood glucose in our body over that period of time, and if you don't have diabetes, it should be less than 5.7. If you have pre-diabetes, your hemoglobin A1C will be between 5.7 to 6.4, and values above 6.4 correspond to diagnosis of diabetes. But you can also check your blood sugar in the morning, and that's referred to as fasting blood glucose. If it's below 100, your values are normal, but values above 100 indicate that your body is starting to show the first signs of having problems controlling your blood sugar, something referred to as impaired fasting blood glucose. Now, another way to check for any kind of abnormalities in the way your body handles sugar is to check your blood sugar 2 hours after meal, which is similar to what happens during glucose tolerance test, when your doctor gives you a specific amount of glucose and then tests your blood sugar 2 hours later. For healthy individuals, this is usually between 130 to 140, depending on which medical guidelines you follow. If it's above this range, you will be told that you have impaired glucose tolerance, which basically puts you at significant risk for developing diabetes. By the way, measuring your blood glucose 2 hours after meal is a much better way to see how your body is handling carbohydrates and if you are at risk for diabetes, since the post-meal blood sugar spikes are more common than impaired fasting glucose. But you might have checked all of these, the fasting blood sugar 2 hours after meal, and even the hemoglobin A1C, and all of the results were just fine. Now, unfortunately, the reality is that even if these results are normal, they don't tell us the full story because these tests simply don't capture the blood sugar spikes that happen right after the meal within that 30 to 60 minute time frame, and that can still cause harm to our body if they repeat themselves frequently enough over a long period of time. So what happens after we eat some carbs and our blood sugar spikes too high? Well, there are multiple things, but at the very basic level, what we see is significant stress on the arteries all over the body, including our brain. One of the reasons for this is inflammation. Scientists are now paying more attention to how much blood sugar fluctuates throughout the day, something called glycemic variability, because these ups and downs may be much better to tell us what's the real impact on our health than just looking at the average blood sugar levels. For that purpose, the researchers are now using something called MAGE, the mean amplitude of glycemic excursions, and that's something that's helping us measure those daily highs and lows. Now, it was clearly shown that when the MAGE goes up because of the blood sugar fluctuations up and down, the risk of oxidative stress and inflammation that causes damage to our arteries went much higher. Now, most people don't realize when their blood sugar spikes after meal because they might think that it's normal to feel slightly off after having a large meal. And also, as I mentioned, the standard tests don't necessarily reflect the short-term fluctuations. Now, as I mentioned, these fluctuations are more commonly seen in individuals who either already have diabetes or those with pre-diabetes. But even people without diabetes can experience these significant spikes, but how often and how high they go really varies from person to person. Now, until very recently, there was no simple or reliable way to know if we are experiencing these post-meal blood sugar spikes, unless you had a diabetes and you have prescribed continuous glucose monitor, the CGM, which really provides the real-time blood sugar data 24 hours a day, minute by minute, through its associated app. Fortunately, that has changed in 2024, and as of now, 3 FDA-approved CGMs exist. 2 of them are available for purchase without prescription, as of the time that I'm making this video. Now, in my opinion, this is total game changer and absolutely phenomenal, because those who truly want to take control of their personal health can now do that better than ever before. Now, I've been using CGM for almost 5 months now, and it really has been an eye-opening journey for me. But I'll talk more about it and how I have been using it, and in my opinion, the best way to get the most out of it in a separate video. But let's now focus more specifically on our brain and see how exactly these blood sugar spikes harm our brain. The one word that sort of summarizes this is oxidation. You see, every time the glucose shoots up too high, it sparks a cascade of free radicals, which are tiny but highly destructive particles that maybe I'm slightly over-exaggerating, but they sort of, you can imagine, tear through the vital cellular structures and cause damage to the proteins, lipids, and even DNA. At the same time, this destructive process is also triggering systemic inflammation. Now, unfortunately, the damage from the blood sugar spikes doesn't just stop when the blood sugar returns to normal. This is one of the worst part of the whole process. See, what happens is every time the blood sugar rises above the normal range, especially those big blood sugar spikes that go close to the 180 level, it triggers the inflammatory response that I just mentioned. But what makes this even more concerning is that these repeated spikes don't just cause temporary inflammation, they actually create sort of memory in the body. Now, scientifically, this means that certain inflammatory genes in the blood vessels stay activated even after the blood sugar level returns to normal. This phenomenon is called metabolic memory. In simple terms, the more often these spikes happen, the more they reinforce and strengthen the harmful inflammatory pathways. Over time, this leads to ongoing damage to blood vessels, even when the blood sugar is normal. So why does it matter? Well, it matters because the inflammation triggered by the repeated blood sugar spikes damages the inner lining of our blood vessels, which is known as the endothelium. This reduces the flexibility of our arteries and plays a major role in development of atherosclerosis, commonly known as hardening of the arteries. When arteries in the brain lose their flexibility and become clogged with atherosclerotic plaques, the brain tissue receives less oxygen and nutrients, which is one of the main mechanisms behind vascular dementia. This whole process is basically put on steroids, or a bullet train if you will, in those individuals who also have elevated cholesterol, which is crucial for the formation of these atherosclerotic plaques. So blood sugar spikes in individuals with high cholesterol, especially the bad LDL cholesterol, is a really bad combination. Now, besides damaging all of our arteries, including those in the brain, chronic inflammation combined with oxidative stress is also breaking down the brain's protective fence. Now, the fence is known as the blood-brain barrier, and it's supposed to keep the harmful substances out of the brain and letting into the brain nutrients that the brain needs. Now, when this barrier gets weakened, it becomes more leaky, meaning fewer nutrients make it into the brain while more harmful substances slip in. Over time, this can increase the risk of memory problems and other cognitive issues. Now, I will be the first one to admit that I was quite shocked to find out how my blood sugar spiked within 30 minutes of moderately high carbohydrate healthy meal, and that within the 2 hours it was pretty much back to normal. Sometimes I felt at the same time the usual feeling of laziness, sleepiness, the so-called food coma as I like to call it, but most of the time I was perfectly fine while my brain was under attack, if you will. So because I became curious if there are any long-term indications that my body has been experiencing these post-meal blood sugar spikes, I decided to get my labs done to see if my overall blood sugar control is also out of whack. Well, sure enough, my hemoglobin A1C was normal, and even when I checked my blood sugar 2 hours after the meals, it was usually between 130s to 140s. So yeah, I'm not diabetic, I'm not pre-diabetic, so I should be feeling pretty good about myself, right? Well, not really. There is another significant issue with blood sugar spikes, and that's formation of advanced glycation end products, AGEs. These are really bad guys. We can get them into our body either from certain foods, something that I don't want to get into today since that's another whole big topic for a separate video. But what I want to talk about today is that our body can also sort of manufacture these AGEs from a combination of having elevated blood sugars, which then binds with our body with proteins or fats during process called glycation. Now, to simplify the way AGEs affect our body, you can imagine the AGEs acting sort of like unwanted sticky coating that builds up on various tissues in our body, including the neurons in our brain. Over time, this sticky coating causes tissue to lose their flexibility, becoming stiff, dysfunctional, and overall making everything in our body age much faster. Now, this gradual stiffening of various parts of our body doesn't just affect muscles, our spine, joints, or blood vessels, but pretty much every organ or tissue in our body, including our brain, where it manifests as worsening memory and cognition. But AGEs have been also associated with mental disorders like depression and schizophrenia. This is due to the fact that when AGEs accumulate in neural tissues in our brain, they disrupt the very delicate networks of the brain and lead to oxidative damage and neuroinflammation. You can think about AGEs as turning your body's flexible tissue into sort of brittle rubber bands that can snap under stress. Now, what's really bad, at least in my opinion, is that the AGEs don't just form after long periods of elevated blood sugars. Now, it's true that our current research data shows that they accumulate more rapidly, primarily in people with chronically high blood sugar, such as diabetics, but it's also believed that the process can start even with the short-lived spikes. While large human studies have not yet confirmed how much damage these brief sugar spikes cause on their own, we do know that the repeated exposure to high blood sugar accelerates the AGE formation over time. The worst part is that this damage could begin long time before we get our routine lab test to show any issues. Basically, the process with the blood sugar and AGEs could be already happening even before reaching the so-called pre-diabetic stage. Now, in the brain, the AGEs directly contribute to oxidative stress and inflammation, which is triggered by the immune system when it encounters these AGEs. What happens is that AGEs bind to receptors on a cell surface called RAGE, receptor for advanced glycation end products. And it's the process when the AGEs bind with the receptor that activates the production of various pro-inflammatory cytokines such as tumor necrotic factor alpha and interleukin 6. As a result, over time, when this process happens again and again, this chronic inflammation further damages neurons and the brain vasculature, which only further compounds the cognitive decline which is associated with conditions like Alzheimer's disease. Now, some might argue that quick blood sugar spikes like those that return back to normal within 20 to 30 minutes are harmless, since even the average healthy person will see mild post-meal increases in their blood sugar. I mean, it's kind of normal. But I'm not really talking about those. What I'm focusing on here are the blood sugar spikes that go above 140 and even those that go closely to the 180 level. These are the elevations that activate the immune system and trigger the cascade of pro-inflammatory cytokines like the TNF-alpha and interleukin 6. It's pretty much self-perpetuating cycle of damage. With repeated blood sugar spikes, the risk of AGE formation increases, and with that we get the accelerated and more intense inflammation and tissue damage. Now, in general, for optimal health, most experts agree that blood sugar for someone without diabetes should remain within the range of 70 to 140 or 130, depending on the guidelines you follow, for the majority of the day, at least 96% of time. This target of 96% is something that aligns with the goals which have been set by the standards for continuous glucose monitoring, the CGMs, for maintaining the so-called time in range, TIR. The time in range is one of the key metrics which is used for assessing blood sugar control with these devices. So, to answer the question, what is the safe number of daily blood sugar spikes? Well, unfortunately, there is no official agreement as to the exact acceptable number of blood sugar spikes per day, but the research is crystal clear. The fewer of these blood sugar spikes we have, the better. Now, sometimes after a high carbohydrate meal, people experience quick spike in the blood sugar followed by a crash. This drop is often called the sugar crash, and it can cause things like fatigue, or basically what happens is when we eat a large meal, after that there is a large dump of sugar into our blood, and insulin is secreted to take care of all that sugar. But once the insulin does its job, it doesn't just vanish right away. It's now all of a sudden there is too much insulin circulating and the blood sugar can drop below normal level, because that's what the insulin does, right? And it basically takes the sugar out of the system and try to put it back into the cell. And so eventually we basically end up with not having enough blood sugar in our blood to provide the energy to our cells anywhere in the body, especially in our brain. And in this scenario, the brain basically may go briefly to low fuel because brain prefers glucose as its main fuel. And as a result of that, we experience the symptoms like confusion, shakiness, and trouble focusing. But there is also a condition called reactive hypoglycemia. This is when the post-meal blood sugar drops become significant enough that the blood sugar falls way below the normal level. Sometimes this is due to exaggerated insulin response. Now, reactive hypoglycemia is often associated with prediabetes or insulin resistance. So it might be something to discuss with your healthcare provider if you are experiencing the symptoms of low blood sugar after meal and it's happening too frequently. But it's important to understand that it can also happen in perfectly healthy individuals, especially those who are not obese. Now, point of this discussion on post-meal sugar crashes is that since glucose is the primary energy source for our brain, as I just mentioned, it should not be surprised that it is during these periods of glucose deprivation that the brain's neurons are really struggling to function optimally, which can pretty significantly affect our ability to think clearly. So these sugar crashes don't just make us feel crappy, but they also affect our ability to remember important information and to solve problems. So people may notice that following the blood sugar spikes, they are more prone to make mistakes, misjudge things, and they may also complain of difficulty with focusing. One of the reasons for obviously not planning to do anything that requires good focus after heavy carb meals or high carbohydrate snacks. Now, one of the big misconceptions is that the main reason for these damaging blood sugar spikes is drinking sodas, juices, or eating sweets. Unfortunately, nothing could be further from the truth. Even things like few slices of whole wheat bread, a large portion of brown rice, or a large ripe banana, and even dried fruits like raisins can cause blood sugar spikes. That's because while the fiber slows down digestion and release of sugar into the bloodstream, consumption of large amount of carbohydrates at once, regardless of the type of carbohydrate, can basically overwhelm the body's ability to process them. The reason for that is that these carbohydrates eventually break down into sugar, which then enters our bloodstream in larger quantities than the body can use it. So while eating complex carbohydrates that contain fiber is much better than eating simple carbohydrates like white rice, what's really important is how much we eat at one sitting. And yes, even some low-fat yogurts are usually loaded with enough added sugars to trigger a quick blood sugar spike. Now, there are other things that we can do to slow down the release of sugar from carbs into our bloodstream, but that's something I'll be discussing in the follow-up video. But the bottom line is that besides the portion sizes and personal genetics, certain combination of carbohydrates with other nutrients like proteins or fat and some specific foods, which is what I'll be primarily focusing on in my next video, will have a major impact on the blood sugar spike. So again, in my next video, I will talk about my personal experience of why I started to become concerned about blood sugar spikes, how to best detect them, and most importantly, how to get them under better control beyond the obvious, not overeating or high carbohydrate meals.